Ladies and gentlemen, good afternoon. The State University of New York, Upstate Medical University, College of Health Professions is happy to welcome you to our commencement ceremony. Today, we are part of a proud tradition in medicine, nursing, and the health sciences. Today, we share your pride and joy. As a courtesy to your neighbors, please turn off or silence any cell phones or pagers that you might have. And now, please rise as we introduce the Upstate graduates of the year 2013. The procession is led by Chief Faculty Marshal, Dr. Victoria McGee. The student marshals are Ann Riley and Robin Leclerc, followed by the College of Health Professions flag bearer, Sean Bardenett. The faculty is led by faculty marshals Ms. Sandra Banis, Ms. Josephine Presprioria, and Mr. Kevin Neville. The academic officers and honored guests include Dr. Hugh Bonner, Dean, College of Health Professions; Dr. Julia Rawls-White, Dean, Student Affairs; Ms. Christian Hosnell, Student Speaker; Ms. Angela El Ponte, Student Speaker; Ms. Joan O'Brien, Senior Associate Dean, College of Health Professions; Ms. Susan Graham, Associate Dean, College of Health Professions; Mr. David Clementi, President, College of Health Professions Alumni Association; and Dr. David Smith, President, Upstate Medical University. Ms. Monica Maranta will now sing the national anthem.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
It is my pleasure to introduce Dr. Hugh W. Bonner, Dean and Professor, College of Health Professions.
Good afternoon, and thank you very much for coming to us. Thank you for loaning us your sons, daughters, your family members. Thank you very much, graduates, for choosing Upstate Medical University to get your education. The healthcare industry is facing a crisis, and it's a crisis of epic proportion. Not only will we have 30 to 40 million new individuals coming online to get healthcare services in 2014, but we will have people who are often more sick, have more problems, and have had difficulty that should have been treated years before. On top of that, we have a strained healthcare workforce that has been overworked for years and will continue to be overworked. Now, to make matters even worse, we have a slew of people who will be retiring over the next 5 to 10 years, which will make it much more difficult for everyone involved in the healthcare system. There are solutions, and they will be taken. And one thing that is very important is that our graduates, these folks here today, are going to be a major part of working out the solutions for those problems. Number one, I think that needs to be done in the very near future is that we have to stop developing or making endless appointments. When someone needs health care, they need it now. They don't need to see their primary care person 1 week and then 6 or 7 weeks later have a chance to see someone else. We need to have payment for outcomes as opposed to payment for procedures, and I think that's already something that's going on in the healthcare system now. We need to have all of our professionals, each one of these graduates, practicing at the very top of their scope of practice so that they are involved in all aspects of treating the patients. We need to have interprofessional teams to assess, plan, and treat the patients as they come into work or into the healthcare system. Just to give you an idea of the impact, just using some of the programs within the College of Health Professions, we know beyond a doubt that if we treat children with asthma, if they have a chance to see and work with a respiratory therapist, we have been able to drop by 50% the times that they have to go into the emergency room, have to use rescue medications, and miss school. Dropping that by half just by seeing someone who can really work with them, develop ideas, and follow through. If we take the medical technologists, the clinical lab science graduates, we do more than 10 billion laboratory tests every single year. 70 to 75% of all medical decisions are based on the tests that are done by our graduates. These individuals need to be involved in the healthcare team, describing what the meaning of the tests are, recommending which tests should be administered, which ones should not be used year after year, and give an idea about what the meaning of many of the outcomes are. Our radiation therapists work very closely right now with the planning of the treatments for the students, or for the patients. We have a program in dosimetry, and we have one of the finest dosimetry programs in the country to work with. These people need to be involved more and more in the planning of the treatments, and since they deal with the patients every time they come in, whether it's up to as many as 34 different visits, they can do a lot of the assessment of the patients, pass that information on to the oncologist, and so forth. Our radiographers, the people in the medical imaging programs, whether they're doing x-rays, CTs, MRIs, medical sonography, and so forth, they have the insights that they should be able to use protocols to make changes in and duplicate or change some of the positioning of the x-rays that are being taken. Our PAs work in the clinics all around the country. They care for the obvious problems of the patients and refer the patients to other practitioners as needed. The cardiovascular perfusions run the heart-lung machine, and in so doing, they control the blood flow of the individual during open heart surgery. They control the gases, the oxygen, carbon dioxide, the electrolytes, and everything else to keep the patient alive. They need to be more and more involved in developing and working on the crisis management of what happens when a line comes loose, or what happens when the anesthesia line snaps. The Doctor of Physical Therapy students have direct access. That needs to be really brought up to a much higher level. Oftentimes when people are injured, whether it's at work, or the weekend warriors playing hoops out in their driveway with their kids have muscle or neuromuscular or skeletal problems. Oftentimes they have to wait for a long time to see their primary care physician, usually a couple days, but to get in to see their orthopedists who they're directed to often takes weeks and sometimes even longer before they can get in. And to steal a phrase from our friends in the law profession, if treatment is delayed, treatment is denied. Now, one of the hallmarks of the graduates of our program are excellence and leaders. And I just want to give you a little background about the two speakers who will speak for us today. We have students from the undergraduate and the graduate programs. Students are nominated by other students, and then we select students who represent the entire undergraduate and graduate class. This year, I'm very happy to announce that for the baccalaureate programs, Angela Aponte will be our speaker. Now, she is nationally honored for her excellence in academics. She was selected by the American Society of Clinical Pathology to be their National Student Honors Award winner, and she's been given the Siemens Scholarship Award. She has been on the dean's list since she came here, and she came from a small suburb of downstate Brooklyn. Since she's been here, she has maintained a 4.0 average, a perfect average, outstanding person. She is involved in her class government. She's also has been elected as the secretary for the Undergraduate Student Government Association. She is a resident advisor, and that really is a very significant title. 8 students are selected to be the resident hall advisors, and she is one of those. She works as a volunteer in a number of different activities. She's taught kids in elementary school about healthy heart activities. She's been on the cancer walks, and she's also worked with the physical therapy students in the Move Along project. One word that really describes Angela is leader. She is indeed a leader. Our graduate speaker is Christina Nietzsche. Now, I was up in a very small town 5 miles from the border of Canada, and in a small town called Fort Covington. Many of you may know about Fort Covington. But I was talking to students about careers in the health professions, and a biology teacher wanted to talk to me. And so I had the chance to visit with him. And he told me that while his sister was a preceptor for Christina, and she said that she's had precepted medical students from Vermont, PA students, nursing students from Vermont as well, and that Christina was by far the best student that she had ever had. Well, I learned a little bit more while I was in the Salmon River High School in Fort Covington. My host there also said that she had been treated by Christina and that she was just very professional, very thorough, and very caring. Then I found out that Christina is from Maryland. What's one of the big things about Maryland and New York State? Lacrosse. Well, she was a lacrosse player. As it turns out, she was a very good lacrosse player, both in high school and college. And she was selected to represent the Czech national team in the European Cup in 2008, and then in 2009, she was in the World's Cup with the team. So what did she do then? She volunteered during the most time-wrenching period of her life, working on a clinical rotation, living in a small town by herself, and then she's giving up her time to work with students. So I think that's another example of a tremendous amount of leadership that she has. So we will all look forward to listening to both of these individuals talk today. And if you have a chance, just kind of notice the bling on Christina's left hand. Thank you.
It gives me great pleasure and honor to present Dr. David Smith, President of the State University of New York, Upstate Medical University.
Thank you, Dr. McGee. Good afternoon. Good afternoon. It's a great day. Well, welcome. Welcome to the 2013 graduation of Upstate Medical University College of Health Professions. It is a remarkable day that we're celebrating with remarkable individuals, along with, of course, a faculty that is indeed second to none. I am certainly proud of our students, the graduates here today, because indeed they're going to be caring for each and every one of us, as we've just heard. But there's a couple things I'd like to do before we get started today, and that is to those people who have always been there to listen, support you in so many different ways. When you needed to talk, we're going to acknowledge them. Those who have provided encouragement and certainly a variety of different methodologies of support, and who may have gone without so that you indeed could achieve and be where you are today. So with that, the students will join me. Will the parents of the graduates please stand and remain standing so we can acknowledge you and your contributions? The parents. Will the husbands, wives, and partners of the graduates please rise? And as a pediatrician, I can't leave them out. Will the children of the graduates please stand or be held? Excellent. We're not done. Will the grandparents and great-grandparents please rise? And not to leave anyone out, any other relatives or friends, please rise. I believe there's as a remarkable group out there as there is seated here, so I certainly know we're in good hands. One of the things we are also here to celebrate is the accomplishment of a very special group of people dedicated to all the degree programs that you have heard here today, and also being part of that honorific group as well. I would like us to honor, if they would please stand, the faculty of the College of Health Professions of Upstate Medical University. The hours of commitment are just remarkable, along with their beliefs and the ability to make a difference. Just a few words of advice before I sit down, and very few. The first one to all of us, and particularly the graduates, those in the professions that we'll be working side by side along with all of us, is to be humble. In a world of the genome and now the potential for miraculous research, remember, there has only been one infectious disease that we've ever eradicated in the history of mankind. So be humble. Smallpox is indeed the only one. Still a great deal of work to be done. In the United States, we still have the biblical diseases, plague, TB, leprosy, and rabies. So think about that for a moment. Be a student of history, an era of multi-drug resistant microbes, emerging infections, and even obesity and the metabolic syndrome. It was Illich who himself, centuries ago, reminded us well that man himself has created new kinds of disease. Be confident in your skills and those of your colleagues in all of the professions. Healthcare is truly a team sport. Be an advocate. walk the talk, because indeed you are in a very special position with your degrees and by virtue of your talents that people will listen. And Churchill reminded us well when he stated, "Courage is what it takes to stand up and speak. Courage is also what it takes to sit down and listen." And finally, sage advice from another very famous doctor: be who you are and say what you think, because those that mind don't matter, and those that matter don't mind. Dr. Seuss. So again, congratulations to the graduates. You're remarkable individuals and great human beings, and we look forward to working with you collaboratively and you returning to Upstate Medical University on a frequent basis. Congratulations.
It is my pleasure to introduce Mr. David Clemente, President of the College of Health Professions Alumni Association.
Hello and welcome. On behalf of the College of Health Professions Alumni Association and myself, I wish you congratulations, and we're very happy for all of you. I'm thinking today of the 2011 White Coat Ceremony, and it just doesn't seem like that long ago. You've accomplished so much in these past 2 years, yet it seems so quick, kind of like a very short story. All of you actually is writing the story of your life, and today you're completing one of those chapters. At some point in your story, you decided to pursue a health career, health professions. That might have been sometime recently, or it might have been from way back. You've decided to dedicate yourself to the service of others. For the past few years, you've been working diligently toward your goal. You've impressed your faculty at your interview. Throughout the weeks and months of each semester here at Upstate, you've worked very hard. You've gone to many classes. You've practiced in many labs. You've spent endless late nights studying for exams. You've written papers, given presentations. You've honed your skills in various clinical settings around the state and beyond. And ultimately, you've turned in final projects and passed final exams. Night after night, week after week, you've persisted. Today, we celebrate your completion of this academic chapter of your life story, which is one of the most important because it defines who you'll be in the next professional chapter of your life story. Today, you can reflect upon the great accomplishments of the past few years with a sense of fulfillment and pride. Today, you can look forward with great anticipation to rewarding careers in healthcare professions, knowing that the noble work you do every day will improve and save human lives. So now, as you segue from student healthcare professional to professional, the College of Health Professions Alumni Association welcomes you as its newest members. We will continue to support all of you and will keep you connected to your fellow alumni and to your alma mater. Today, as you cross the stage, you'll receive your Alumni Association pin. As you wear it, let it be a reminder of your days here at SUNY Upstate and the awesome opportunities that this experience has made available to you. And down the road, when the Alumni Association contacts you, please think of all the doors of opportunity that have been opened to you here at SUNY Upstate, and please support your Alumni Association to help others open those doors for future healthcare professions through the many scholarships that we provide. The Alumni Association and all of us here at Medical Upstate University are so proud of your great accomplishments, and we're very happy for you as you begin your new professions. So now, as you move on to your next exciting chapter. We wish you success and fulfillment in your careers and much happiness in your lives. Thank you.
Angela Aponte, a graduate in the Clinical Laboratory Sciences program, has been invited to speak as the undergraduate student speaker. Thank you.
It is indeed an honor to speak on behalf of my fellow graduates. To them, I say congratulations. Our long hours of studying, not eating, and partying has paid off, and we made it. Our journey here, on behalf of all our graduates, I would like to say thank you to our parents who supported us financially, emotionally, and physically, to our dean for always being involved, and to the professors and faculty of our programs for their guidance, instructions, and great leadership. Our journey here at Upstate has been challenging, and some of us may have experienced potholes along the way. But with hard work, perseverance, and determination, we have overcome. Our programs are demanding, which caused many of us to feel uncertain, dismayed, and frustrated at various points in our journey. However, we did not give up, and for this, you must be proud. I know I am. Be proud of all your accomplishments and the obstacles you have overcome to be here today. Our time here has also been exciting, interesting, and rewarding. It has been exciting because of the new material we learned and the friends we met along the way. Interesting because we learned how each of our professions can contribute to the healthcare field as a whole. And rewarding because we work together to achieve our goal of graduating. Over the years, we have developed relationships, not only with classmates, but with faculty, deans, and most importantly, with patients. These connections have allowed us to succeed here at Upstate. I hope these relationships stay with you throughout your career for the support, encouragement, and motivation they have brought to you. Today, we leave Upstate University prepared mentally and emotionally for the professional world because our professors have equipped us with the materials and tools necessary to become great leaders. Our journey does not end here, as technology and healthcare is always changing. We must build upon the foundation of our knowledge to keep up to date with the new technology so that we can provide the patients with the best care. Graduates, no matter what profession you enter, stay focused, be humble, be observant, and remember that it takes a team to care for a patient. Be true to yourself so that others can do the same. Have fun and enjoy what you do because we have the power to impact lives. Let us continue to learn and strive for greatness so we can make a difference. Most importantly, let us not lose the compassion to help others and the passion for what we do, which has been the foundation of our journey. Good luck and much success in all your endeavors. And again, I say congratulations. And before I end on this note, I'd like to acknowledge one of my classmates, Kristen, who was unable to attend graduation but worked hard and long with her fellow classmates to be acknowledged. So I'd like to say congratulations, Kristen, and again, congratulations, graduates.
Christina Nidza is a graduate in the Physician Assistant Program and has been invited to speak as the graduate student speaker. Will Ms. Nidza please come forward?
Good afternoon, everyone. My name is Christina Hiesta, and I'm a member of the 2013 Physician Assistant graduating class, and here representing all the graduate programs in the College of Health Professions at Upstate. I'm honored to have been chosen by my peers and professors to speak to all of you today. I also have some great news. I'm the last speaker today. It has been a tremendous journey for each of us, but we made it. We have dreamed of this moment for a long time. Some of us, since we were just a little girl, sitting on her grandfather's knee, promising him she would take care of him one day. We persevered through all of the strenuous exams and countless hours of studying. We stayed dedicated through summers and holidays. We worked hard to be perfectionists in our respected fields. All of this leading up to the day when we could finally say, I am no longer a student. There is, however, one thing I want to ask of my peers. I ask that you remain in the mindset of students. As students, we are eager to learn and accomplish. No task is too small or insignificant for us. We jump at every opportunity to attend to and treat patients. We spend all day in hospitals and clinics treating patients, being meticulous, and paying every attention to the details in the note in each chart. We then spend our own time, whether it be at home or elsewhere, reading about anything we didn't know, only to then go back the next day with an attitude to do better and achieve more. We research new techniques and are open to using the latest technologies and advances in our fields to improve them. We are excited to finally be out of the classroom and putting our knowledge to good use. We work very hard at everything we do. This kind of work ethic is invaluable. Just think of all the lives each of us will have an opportunity to touch, heal, and save. I hope that you will continue to work hard as you do now and remain lifelong learners. I am very proud of all of you and honored to call you my fellow colleagues and friends. Finally, I want to send out a heartfelt thank you from myself and behalf of our entire graduating class. Thank you to God, thank you to our parents, brothers, sisters, families, to our fiancés, husbands, wives, boyfriends, girlfriends, friends, professors, and to all others that have impacted us in our experience here at Upstate. Thank you for supporting in us, believing in us, and everything you have done in helping us reach this point. We are grateful, and we love you. Thank you.
The degrees from the College of Health Professions will now be conferred by President Smith. Dr. Hugh Bonner, Dean of the College of Health Professions, will present the recipients of the degrees in the College of Health Professions. Undergraduate students receiving academic honors have met the following grade point criteria. Summa cum laude, 3.90 to 4.0. Magna cum laude, 3.75 to 3.899. Cum laude, 3.60 to 3.749. Graduate students receiving academic honors have met the following grade point criteria. High honors, 3.90 to 4.0. Honors, 3.80 to 3.899. Post-professional doctorate of physical therapy graduates are not eligible for honors.
President Smith, as Dean of the College of Health Professions, I have the honor to present the recipients of the degrees Bachelor of Science and Bachelor of Professional Studies. With the completion of the curriculum, they will be satisfied the requirements established by the faculty and have been recommended by the faculty for the conferring of this degree.
Thank you, Dean Bonner. Will all the candidates for Bachelor of Science and Bachelor of Professional Studies please rise? By virtue of the authority vested in me by the State University of New York Board of Trustees, I hereby confer upon each of you the degree Bachelor of Science or Bachelor of Professional Studies to which the Dean has recommended you, with all rights, privileges, and obligations thereunto. Congratulations. We will proceed with a personal recognition.
Ms. Kelly Ann Feather, Cardiovascular Perfusion, Bachelor of Science, magna cum laude, also Department of Cardiovascular Perfusion Academic Excellence Award. Claire Jara, Cardiovascular Perfusion, Bachelor of Science, cum laude, Excellence in Professionalism Award, the John Bernard Henry, MD, Endowed Scholarship. William D. Jones III, Cardiovascular Perfusion, Bachelor of Science. Thomas Scott Cantor, Cardiovascular Perfusion, Bachelor of Science, also Department of Cardiovascular Perfusion Clinical Excellence Award. Stephanie L. Radford, Cardiovascular Perfusion, Bachelor of Science. Susan A. El Salame, Clinical Laboratory Sciences, Bachelor of Science. Angela L. Aponte, Clinical Laboratory Science, Bachelor of Science. Summa cum laude, Rinker Robinson Memorial Scholarship recipient, American Society for Clinical Pathology and Seaman Scholarship recipient, American Society for Clinical Pathology National Student Honor Award, and the Dean's Outstanding Award. Bridget Burns, Clinical Laboratory Sciences, Bachelor of Science. Victoria I. Cooper, Clinical Laboratory Science, Bachelor of Science. Abigail Elizabeth Dietz, Clinical Laboratory Science, Bachelor of Science, Student Research Award recipient. Matthew R. Jackson, Clinical Laboratory Science, Bachelor of Science, magna cum laude, American Society for Clinical Pathology and Seaman Scholarship recipient, American Society for Clinical Pathology National Student Honor Award. Angela Knox Lawn, Clinical Laboratory Sciences, magna cum laude. Stephen Masterpolo, Clinical Laboratory Science, Bachelor of Science, magna cum laude. Nadia Mubarki, Clinical Laboratory Science, Bachelor of Science, magna cum laude. Kaylee K. Mubata, Clinical Laboratory Science, BS, Student Research Award recipient. Andrea Leigh Montagna, Clinical Laboratory Science, BS, cum laude. Brian V. Monteroso, Clinical Laboratory Science, Bachelor of Science, cum laude. Dominique Ortiz, Clinical Laboratory Science, Bachelor of Science, magna cum laude. Christopher Michael Roberts, Clinical Laboratory Science, Bachelor of Science. Brian C. Rudy, Clinical Laboratory Science, Bachelor of Science, summa cum laude. Jessica Marie Toy, Bachelor of Science, Clinical Laboratory Science, magna cum laude, Student Research Award. Susan Zacharine, Clinical Laboratory Science, Bachelor of Science, summa cum laude, also Student Research Award recipient. Andrew R. Christian, Medical Imaging Sciences, Bachelor of Science, magna cum laude. Nicole R. Clapper, Medical Imaging Sciences, Bachelor of Science, summa cum laude. Shauna Rose Diddle, Medical Imaging Sciences, Bachelor of Science, summa cum laude. Kelly A. Garcia, Medical Imaging Science, Bachelor of Science, magna cum laude. Samantha Ann Gerard, Medical Imaging Sciences, Bachelor of Science, magna cum laude. Justine Hutchings, Medical Imaging Sciences, Bachelor of Science, summa cum laude, and recipient of Outstanding Academic Achievement. Mindy Ingerson, Medical Imaging Sciences, Bachelor of Science, magna cum laude. Paul A. Kwiat, Medical Imaging Science, Bachelor of Professional Studies, magna cum laude, Outstanding Academic Achievement. Matthew Klump, Medical Imaging Sciences, Bachelor of Science, summa cum laude. John C. Knack, Medical Imaging Sciences, Bachelor of Science. Kelly Marie Lambie, Medical Imaging Science, Bachelor of Science, summa cum laude. Chelsea M. Love, Medical Imaging Sciences, Bachelor of Professional Studies. Rebecca M. Lum, Medical Imaging Sciences, Bachelor of Professional Studies, magna cum laude. Amanda Sue Manning, Medical Imaging Sciences, Bachelor of Science, magna cum laude. Sarah M. Maynor, Medical Imaging Sciences, Bachelor of Science, cum laude. Brianna Mae Marshall, Medical Imaging Sciences, Bachelor of Professional Studies, magna cum laude. Rachel A. Madison, Medical Imaging Sciences, Bachelor of Science, cum laude. Carrie A. Nash, Medical Imaging Science, Bachelor of Science. Jennifer P. Oviedo, Medical Imaging Sciences, Bachelor of Science, magna cum laude. Alyssa Ann Reel, Medical Imaging Sciences, Bachelor of Science, magna cum laude. Samuel J. Robbins, Medical Imaging Sciences, Bachelor of Science, magna cum laude. Kara A. Sculacci, Medical Imaging Sciences, Bachelor of Science, magna cum laude. Kayla Taft, Medical Imaging Sciences, Bachelor of Professional Studies. Jamie M. Taro, Medical Imaging Sciences, Bachelor of Science. Alex Van Nastrand, Medical Imaging Science, Bachelor of Professional Studies, summa cum laude. Valerie Marie Benedict, Radiation Therapy, Bachelor of Professional Sciences. Heather L. Brokima, Radiation Therapy, Bachelor of Professional Studies, magna cum laude. Michael A. Burke, Radiation Therapy, Bachelor of Professional Studies, summa cum laude, Radiation Therapy Department Award in Academic Achievement. Zachary A. Daniel, Radiation Therapy, Bachelor of Science. Danielle Lynn DiBona, Radiation Therapy, Bachelor of Science, summa cum laude. Katie Ann Hudson, Radiation Therapy, Bachelor of Science, cum laude. Donald Christopher Longo, Radiation Therapy, Bachelor of Science. Nicole Elaine McIntosh, Radiation Therapy, Bachelor of Science. Alyssa Ann Monette, Radiation Therapy, Bachelor of Professional Studies, cum laude. Joseph E. Pagano, Radiation Therapy, Bachelor of Science, cum laude. I know. Dana A. Spencer, Radiation Therapy, Bachelor of Science, magna cum laude. Deborah Tetrault, Radiation Therapy, Bachelor of Science. Emily Vanderveken, Radiation Therapy, Bachelor of Science, cum laude. Chelsea Allen, Radiation Therapy Education, Bachelor of Science. Stephen Reynolds Allen II, Respiratory Therapy Education, Bachelor of Science. Timothy N. Backus, Respiratory Therapy Education, Bachelor of Science. Jason Hugh Joseph Boyle, Respiratory Therapy Education, Bachelor of Science, recipient of the New York State Society for Respiratory Care, Central New York Chapter Distinguished Student Award. Deborah E. Foley, Respiratory Therapy Education, Bachelor of Science, summa cum laude, recipient of the Lambda Beta National Honor Society for Respiratory Care. Jacob C. Hollis, Respiratory Therapy Education, Bachelor of Science. John T. Lisi, Respiratory Therapy Education, Bachelor of Science, summa cum laude, recipient of the Department of Respiratory Therapy Education Outstanding Student Award and member of the Lambda Beta National Honor Society for Respiratory Care. Kayla Faye Masters, Respiratory Therapy Education, Bachelor of Science, magna cum laude, Department of Respiratory Therapy Education Clinical Practice Award. Lillian Malkoviz-Masako, sorry about that. Respiratory Therapy Education, Bachelor of Science. Kwai Ting Ngo, Respiratory Therapy Education, Bachelor of Science, summa cum laude. Andrea Radionov, Respiratory Therapy Education, Bachelor of Science, summa cum laude, recipient New York State for Respiratory Care, Central New York Chapter Academic Achievement Award, member of the National Beta Honor Society for Respiratory Care. Dmitry Shantrov, Respiratory Therapy Education, Bachelor of Science, summa cum laude. New York State Society for Respiratory Care, Central New York Chapter for Academic Achievement Award, member, Lambda Beta National Honor Society for Respiratory Care. Lori Tome, Respiratory Therapy Education, Bachelor of Science, magna cum laude. Michael Wixon, Respiratory Therapy Education, Bachelor of Science, summa cum laude, Department of Respiratory Therapy Education Community Service Award, New York State Society for Respiratory Care, Central New York Chapter Academic Achievement Award, Lambda Beta National Honor Society for Respiratory Care member.
President Smith, as Dean of the College of Health Professions, I have the honor to present these recipients of the degree Master of Science. With the completion of the curriculum, they have satisfied the requirements established by the faculty and have been recognized by the faculty for conferring of this degree.
Will all the candidates of Master of Science degree from the College of Health Professions of Upstate Medical University please rise? By virtue of the authority vested in me by the State University of New York Board of Trustees, I hereby confer upon each of you the degree Master of Science, for which the Dean recommends with all rights, obligations, and privileges thereunto. Congratulations. Please proceed to be individually recognized.
Ashley Noel Green, Clinical Laboratory Sciences, Master of Sciences, High Honors. Okay, folks, you got to be back. Yeah. Okay. Ali Ahmed. Leela Akaben, High Honors. Carly Beachy, Physician Assistant Studies, Honors. Emily L. Clark, Physician Assistant Studies, High Honors. Colin Kiniski, Physician Assistant Studies. Laura Rhodes Connor, Physician Assistant Studies, High Honors. Amber Patrice Contrastan, Physician Assistant Studies, High Honors. Allison M. Demio, Physician Assistant Studies, Honors, Outstanding Academic Achievement. Lauren E. Dinsmore, Physician Assistant Studies, Honors. Laura A. Fink, Physician Assistant Studies. Christopher K. Geis, Physician Assistant Studies. Christina Niesda, Physician Assistant Studies. Alicia W. R. Holtz, Physician Assistant Studies, High Honors, Outstanding Academic Achievement Award. Jacqueline A. Millay, Physician Assistant Studies. Diana M. Manning, Physician Assistant Studies, High Honors. Victor Nami, Physician Assistant Studies. Audrey Elizabeth Opatisano, Physician Assistant Studies, High Honors, recipient of Outstanding Academic Achievement. Adam W. Paddock, Physician Assistant Studies. Brittany Jade Pugh, Physician Assistant Studies. Karen Bart Reamer, Physician Assistant Studies, Honors. Lauren Riley Scott, High Honors, Physician Assistant Studies. Nicole Elizabeth Scott, Physician Assistant Studies, high honors. Sandra E. Sekuterski, Physician Assistant Studies. Bryn Marie Spencer, Physician Assistant Studies, honors. Melissa Tiletnik, Physician Assistant Studies. Mercy M. Upe, Physician Assistant Studies. Marisa Joanna Vespa, Physician Assistant Studies, high honors. Caitlin M. Wright, Physician Assistant Studies, high honors.
President Smith, as Dean of the College of Health Professions, I have the honor to present the recipients of the degree Doctor of Physical Therapy. With the completion of the curriculum, they have satisfied the requirements established by the faculty and have been recommended by the faculty for the conferring of this degree.
Thank you, Dean Bonner. Will the candidates for the degree Doctor of Physical Therapy please rise? By virtue of the authority vested in me by the State University of New York Board of Trustees, I hereby confer upon each of you the degree Doctor of Physical Therapy as recommended by the Dean, with all rights, privileges, and obligations thereunto. Congratulations. Please proceed for individual recognition.
Dr. Gillian Faith Arnaboldi. Dr. Sean Michael Bardenett. High honors, Department of Physical Therapy Education Academic Achievement Award, State University of New York Chancellor's Award for Student Excellence. Dr. Lindsay Ellinson Bateman. Dr. Kimberly Ann Bilodeau. Dr. Kathleen T. Bronchetti. Dr. Jennifer Ann Cady, recipient of the Student Research Award. Thank you. Dr. Matthew J. Caraher, recipient of the Department of Physical Therapy Education Professional Participation Award. Dr. Jennifer Marguerite Cobb, honors. Dr. Ann E. Campo. Dr. John Timothy Denoyles, recipient of the Student Research Award. I like that one. Dr. Jamie Lynn Edwards. Dr. Christine Phelan Elliott, honors. Dr. Justin D. Farnsworth. Dr. Christian Grace Gershon. Dr. Maureen E. Harnan, recipient of the Student Research Award. Dr. Shauna R. Harvey, recipient, Student Research Award. Dr. Michaela Haslatova. Dr. Hillary Jacobson. Dr. Jillian E. Johnson. Dr. Andrea B. Leifer. Dr. Nathan Charles Laughlin, recipient of the Michael T. Bone Physical Therapy Practice Scholarship. Dr. Abigail Catherine Lynch, High Honors, recipient of the Department of Physical Therapy Education Academic Achievement Award and recipient of the Rystrom Scholarship Award. Dr. Caitlin McDonald. Dr. Joseph John Mika, High Honors, recipient of the Department of Physical Therapy Education Academic Achievement Award and an award for the New York State Physical Therapy Association Student Participation Award. Dr. Marianne Nye Munson. Dr. Megan Ann O'Shea. Dr. Amy Lynn Regato. Dr. Abby Lynn Ross. Dr. Kaylee T. Sleddy, Honors, recipient of the Department of Physical Therapy Education Clinical Excellence Award, recipient of Student Research Award. Dr. Jamie Lynn Smith. Dr. Caitlin Maribah Smith. Dr. Thomas M. Spangenberg, High Honors, recipient of the Department of Physical Therapy Education Academic Achievement Award. Dr. Danielle Marie Van Gorder. Dr. Aaron C. Dolan. Dr. Kathleen Burns Karn. Dr. Christopher David Lonnie. Dr. Misty Fearon. Dr. Michael E. Oliver. Dr. David Viscom.
The oath of the health professional, which is printed in your program, will be administered by Dean Bonner. Will the graduates of the College of Health Professions please rise?
If you'd please follow along and read after me by whole sentence. In the presence of my colleagues, family, friends, and teachers, I proudly make this solemn vow. I will give to my teachers the respect and gratitude that is their due, and share my knowledge with those who follow me. I will conduct myself with professional integrity, placing service to others before personal gain. I will treat all my patients with empathy, being sensitive to their beliefs, values, and background, providing care equal in quality and compassion. I will honor the privacies of those seeking my help using their health care information, that which was revealed in confidence, solely to support their treatment. I will continuously strive to learn of the advancements in my field, embracing new techniques and technologies that will improve my patients' experience. I will recognize that each patient care is provided by a team of professionals, and my responsibility to my patient and my colleagues is to uniformly honor this pledge without fail for the betterment of the patient and my profession. This I do swear freely and upon my honor as I commit myself to service through my profession. Thank you, and be seated. Each year, the faculty in the College of Health Professions have the opportunity to nominate students for the Dean's Outstanding Student Award. This award is given to a student who combines academic excellence and outstanding campus, professional, or community activities while a student at the College of Health Professions program. This year we have selected, and it's already been let out of the box, Angela Aponte for the Clinical Laboratory Sciences program. Angela, would you please come forward? Congratulations. You were supposed to go ahead of time.
Thank you.
As we are closing, I would ask again if the faculty from the College of Health Profession, would you please stand for a moment? The students are our reason for being. We love what we do, and every day I think we're all glad that this is the opportunity. But really, the heart and soul of our program and the reason that we have been so successful over the years that we've been at college is because of the continuous dedication of our faculty. Graduates, would you please stand up and applaud your faculty? Thank you, and you may be seated. This does complete our ceremony, and we'd like to congratulate all of our graduates. There will be a reception immediately following the ceremony in the campus activity building back on campus. The recipients of the awards may pick up their awards at an awards table at the reception, and a photographer will be available to take photos of the graduates, their families, and their friends. As a reminder, the graduates will recess to the outside of the building, so would you please all meet with them outside, and if you would remain standing and applaud the graduates as they walk out of the building, but please do not leave your seats as the graduates leave the building. And I would like to thank all of the people involved with putting the program together, Dr. Julie White and her staff, Sharon Heward, Chuck Simpson, and others in the Department of Student Affairs. And I'd like to thank Upstate's physical plant and crew for everything they've done. Class of 2013, congratulations, and please stand up. Faculty will be led out by our faculty marshals.